and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. Over the last few weeks, we've had a number of discussions with regards to women's health. We even had a Women's Health Day here on our campus at AUA to address issues such as prevention, heart disease, the importance of mammograms. We actually have with us today a panel to discuss some of the issues associated also with women's health, as well as input from one of our local physicians as to other measures women should take here in Antigua and Barbuda to maintain good health. As we said at the top of the program, we recently had a very successful Women's Health Day, and the contributing factor to the success of that Women's Health Day, by and large, the patients that showed up, but as well as our students here, along with Dr. Raymond Mansour from one of our local OBGYNs. We'll have an opportunity to meet each of them individually, as well as hear what their contributions to the Women's Health Day really were. We'll start with the medical students themselves. If you could introduce yourselves individually and maybe give a little tidbit of where you're from, a little background information from you. We'll start with you.
My name is Jessica Goldberg. I am a Med 2 student here at AUA. I am from South Florida, and I used to specialize in what's called emergency physician scribe. So I was an emergency room scribe for about 2 years.
And you gave all of that up to come to Antigua?
I did. I wanted more.
Okay.
So I wanted to have a scribe. So yeah, I gave that up, and I'm really happy here. I'm learning a lot, and I'm able to apply a lot of what I learn in a real clinical setting.
Excellent. Well, welcome, Jessica. And yourself?
My name is Jonathan Bubb. I'm from upstate New York. I'm currently the director of the emergency response team here on campus. And prior to coming here, I was a paramedic for about 9 years in upstate New York, Massachusetts, and areas like that.
And it sounded like, Jessica, you wanted more.
Yeah, pretty much. I just want to be able to advance my knowledge and really learn more about taking care of patients.
Excellent. And welcome, Jonathan, as well.
Hi, my name is Hassanatu Blake, and I'm also a student here. Prior to coming to AUA, I was working in global health. So I was living in Zambia and other different African countries. I'm originally from Cameroon, but raised in Maryland.
And so your experience, your exposure rather, gave you as well that sort of the impetus, the push to learn more?
Definitely. Coming from a perspective where you're serving the masses and educating them to be more proactive about their health, I wanted to get a more medical side to health. So coming to AUA seemed like a good fit.
Well, welcome to Healthy Perspectives.
Thanks.
Dr. Mansour, no stranger to our program. Welcome back.
Thank you for having me again.
I told you would be in that seat very soon.
Anytime.
Well, guys, we were talking about the Women's Health Day, and a few of you had an opportunity to be here on campus for the event. What did you see? What was your experience like for the Women's Health Day?
I thought it was a great experience for local women to come out and not only get interviewed by real medical students, but also to learn about women's health and be examined by the physicians who also work at our school. So I thought it was a great opportunity and experience for women to not only learn about what illnesses they may have, but more about prevention. Did you,
from your experience and even from your education thus far, do you feel that women's health issues have been lacking, that not enough attention has been placed on the preventative side of things?
I think that with more common knowledge, there would be more prevention. I think that there are some who just don't know. They don't know what signs to look for, or they don't know when to come see a physician. And so I think just that promotion, that health promotion, really budges them to, okay, look into things. So I think it's a benefit for everybody.
Excellent. And what about yourself, Jonathan? What was your experience with it?
I thought it was a very good experience, not only for the women who are actually coming and getting the checkups and to make sure everything is going well with their health, but also for our students to really start to see, just how taking care of patients is and the different aspects of men's health versus women's health and general care and, the antenatal and the prenatal aspects of a woman's health throughout her life.
Exactly, very good. Now, you had a chance also, Asa, to spend some time, but I think you have a different perspective because you dealt with the masses before.
Yes.
From your background. So how do you compare what you saw here versus what you've seen in the past?
What I've seen in the past, I think this is in line with what I was doing in the past, really focusing on education and empowering people to be proactive about their health. And I think it's always a good thing to educate people to know what to look for, like Jessica said earlier, and also to inspire them to take charge of their health. So
I'm gonna, and forgive me if this is putting you on the spot in any way. Definitions of health fairs vary across the world, and what people may want to do for health promotions and health literacy vary. From what you've seen in the past, are health fairs generally, okay, you go to a spot and you go to a booth and you have your blood pressure checked, or you go here and have your glucose checked, but then you may not necessarily have a chance to speak to a healthcare provider. Have you seen that in the past?
I've definitely seen that, but a lot of the health fairs that I've been to have focused on disease. Whereas I think a good thing about this one, it was about general health and giving information about staying healthy in general. So we did touch upon various different diseases, but it was really about health promotion in general, which I think that was a really good thing to focus on.
And lifestyle, how do you guys feel? Did you feel that enough emphasis was really put on helping people to make lifestyle changes? As you said, not just focusing on one thing. Did you see that?
Yeah, I think it was a really good push at the health fairs, actually different aspects that you might need to change in your own personal life. Am I eating well? Am I taking good care of myself? Or am I getting good checkups? I did the EKG station where, some people have never had an EKG, or, they're 60 years old and it's time to really start checking on how is my heart doing, things like that.
Excellent. Jessica, yourself?
I thought it really did promote lifestyle, a healthy lifestyle. There were different stations set up, and part of them actually brought healthy foods. The diabetic table actually had things that you should be eating, whereas things that you should not be eating, to also incorporate in your own diet. So you end up going home with knowledge. Yes, you were looked at, but you also go home with more than that. You're able to prevent anything from happening again. So that whole perspective of health promotion was a large part in the health fair.
Itself.
Yes, itself.
Dr. Mansour, if I can draw you into this also, do you see a need for more events like this in the community from the patients you see on a daily basis?
Well, primary health care is a vital part of any office or hospital or community clinic. And a major portion of that is education. I think if you set up anything that doesn't have that education side of it, it's just not going to work. We cannot only be curing diseases, we've got to be able to find a way to limit their occurrences, so we need prevention. We have had a number of health fairs here in Antioch over the last few years, and I think with great success, most of them have. And if you looked at the population base of those who attended, predominantly women. So when we have women health fair, we know we're going to get a good turnout usually, because the girls are always interested in their health, and it doesn't have to be anything major. Like as you guys said, simple little educational tidbits. What are good foods? What are bad foods? How often should I have my blood pressure checked or my cholesterol checked? So these are always going to be important to do, and I don't think we should stop doing them. I think they're very important to the community at large. It also brings brings the patient out of the office a little bit as well, kind of brings it in a more community sense. So they might be, encouraged because, my friend came, so I'm going to come.
Right.
So rather than me having to make my own appointment to the doctor's office where I'm more nervous, I have a little partner, a little buddy who's going to help me out with my few steps that I need to do. And you'd be surprised how many people come to our offices from these clinics because, from the fairs, because they find an elevated blood pressure which they didn't have before, or an elevated cholesterol. So they come to the doctor's office at that junction and say, well, doc, I need some help with this particular problem. So I think they're vital. I think, what they did here was really good. I think it would have been the second or third that they've had in the last couple of years, which I think is we only need more. I think the more we do, I think, is because you're going to get different people each time.
Okay.
And so.
All right. I'd like to ask you a controversial question as soon as we come back from a break. We have
Sure.
to take a quick break. We ask you to stay with us. We'll be right back. If you're just joining us, we have a small panel from our recent Women's Health Day, a group of students as well as Dr. Raymond Mansour that helped us pull things together. And before the break, Dr. Mansour, I was saying I wanted to ask you sort of a controversial question. And really it has to do with health fairs themselves, because there's the talk that health fairs can send the wrong signals. It may give patients the impression that, hey, I'm okay, so I don't need to go to my doctor, which is why I found it interesting that you made the statement that patients are coming to you.
Yeah.
Do you think these type of events may at any point send a wrong message, or is that again part of the education that just needs to go along with it?
You got to vary it. You can't have one type of education only. There are going to be some people who are going to be comfortable to go to fairs and other people who will say, no, I'm going to go to my doc. But for that group that comes to the fairs, I think if the message is appropriate, so if it's a women's health fair and you're going to focus on, say, lifestyles, then if once the message is at the patient's level, so educational level, so they understand what the students are saying or what the physicians who are coming to help you with the fairs are saying, and they leave with the appropriate information, I think there's no harm in that, honestly. I think, a lot of times you have enough privacy in the booths that allows a certain amount of communication that, that will allow the person to be open in her answers or his answers. So no, I don't think I see any big issue with it. I think if you disenfranchise one or two of those people who come to the fair, then they just won't come back.
Right.
And they'll go and see their doctor. But I don't see a big issue with it, honestly.
Fair enough.
Yes.
Which is why I also think that at this particular event also, you guys had some special projects that you had to do leading up to the event. How did that help you also on the day of? Did it open your eyes in doing additional research? And we'll get into exactly what those special projects were. But do you think it prepared you in any way for meeting some of the patients that you encountered? Jessica, we can start with you.
I'm not sure that it necessarily helped during the health fair. I was running, so it wasn't, I was helping organize the fair, so it wasn't that I would get to talk to a lot of the patients one-on-one. The research that you mentioned was concerning differential diagnoses for genital lesions. So appropriately, it happens to be at a women's health fair. I don't think there was a strong correlation, but there was some. There are so many different lesions, and in the genital area for women to recognize the different signs.
So you took us down the road of what your project was actually about. What did you find in your research then?
I researched molluscum contagiosum. It's actually it's considered a differential diagnosis for genital lesions just because of the fact that it can be found in the genital region. So it can occur not only in sexually active adults, but also in children, in immunosuppressed individuals. So just the fact that it can be found in the genital area, you would consider it as a differential diagnosis. So, but it's a rather benign, it's viral, and it affects the skin. So it's a skin infection produced by the contagiosum part is the fact that it just happens to be very contagious.
Right.
So children will go out, they'll share objects, they'll share clothes, and then they contract it from one to the other. there's no real treatment. It goes away spontaneously. There are alternative treatments, but it's rather benign.
So now I take it to you, Dr. Mansour. Is it something that we find commonly within our...
Not typical in the adult population. It's more a pediatric issue. It can be transmitted by intercourse, simply because if one partner has the lesion on the genitals and the genitals are in contact with each other, then yes, you can transmit it from one to the other. And so by definition, that part of it is referred to as a sexually transmitted, but it's mainly a pediatric contact-to-contact issue, reasonably contagious and thankfully benign. And there's tons of different treatments that can be offered, particularly if the lesions are painful, and there depends on the location of lesions. They can be painful, and so therefore treatment could be indicated for that at that juncture, but patient by patient basis only.
Without going too deeply into it, because it is a pediatric matter, is it something that parents should be overly concerned about?
No, there's no long-standing health issues associated with it. We do know that the lesions may take up to 190 days to go away. So it can be concerning during that 3 or 4 month period while they have those little raised bumps on the skin. No, I think it should be okay. Just counseling again, or public education.
Education.
Yeah.
Very good. Thank you.
Thank you
for that. Jonathan, and your topic was?
I did some research on syphilis.
Okay.
Right now it actually has become quite a large issue in the United States. Even though it's highly treatable, highly preventable, patients are still not really taking the time to make sure that they are treated for it or practice safe practices, and it's still being transmitted quite a bit between, especially the homosexual male population.
Okay. You make a statement that people are not seeking the treatment for it. Is that, again, based from your research, and please, Dr. Mansour, jump in, is it lack of education, or?
I think some of it has to do with lack of education. Some of it could just be that patients aren't real willing to get the treatment that they need, or they might not really understand what it actually is that they have contracted.
Considering, and you touched on two interesting points for our population, treatment costs. Is it an excessive cost that they would then have to? As far as syphilis goes, it's actually still primarily treated using penicillin, which is extremely cheap. It's usually not more than a few dollars, and I mean, at least in the United States, it's free at most supermarkets. And is that basically the same here, Dr. Mansour, as far as cost is concerned?
No, penicillin G, which is the standard of care for syphilis, is relatively inexpensive. It's not something that should prevent anybody from getting treated. The issue with syphilis is twofold, actually. One is the lesions are there, but unfortunately painless, reasonably painless. So a lot of patients will watch. Maybe it'll go in its own. I'm not having much pain, so I'm not going to worry about it. But unfortunately, at that time, fairly contagious to whoever they're having intercourse with. And the second issue is that you can have a primary infection without actually seeing a lesion. And so you go into secondary syphilis, which can then disseminate into the body, and then that's when they first present with an issue. And so it'd be of no fault to the patient because they didn't see anything. Sometimes the lesions are internal, so it could be in the urethral meatus, could be if it's men having sex with men, they can have it in the rectum or in the vagina. They won't see it because they're not able to touch it or anything like that. But the person can have a primary lesion, not be aware of it, and then end up having secondary syphilis, which is when it starts spreading to the other organ systems, and then that's when they present. So you're almost chasing the boat at that juncture. It'd be better if we got them at that primary episode.
Once it has reached that point, though, what should they expect?
Well, it depends on what it hits. It unfortunately does hit a few systems, so you're looking at anywhere from eyes to kidneys to heart valves to it spreads. So I guess you're at that juncture, depending on the patient presentation, then you treat based on what he or she has. But penicillin G is still the drug of choice for syphilis treatment. Usually injectable. It has to be intramuscular. And by the time they are in their secondary phase, then you're looking at 3 doses 1 week apart. and that usually works really well. We've been using now Pen-G for the last 50 years to treat syphilis, and studies have not shown much resistance of the syphilis to this. So it's still the cheapest and probably the best drug to use for that.
Okay. When we come back, another break. Sorry, guys. What portion of the population are we here in Antigua really seeing? Stay with us. We'll be right back. Welcome back. We're continuing our discussion with some of our medical students as well as Dr. Mansour. Dr. Mansour, just before the break, we were talking about one of the STDs, and is it one that we find very common here?
It's one of the more common ones, but it's not truly common by itself.
Okay.
It's only about 7 to 10% of our STIs. So you still have HPV and HIV taking a little bit of the brunt of it, and some of the other ones, gonorrhea and chlamydia. So syphilis is still there. In our patient population that are pregnant, it's actually even smaller. Okay. So it's not a very large number. I'd probably put it at maybe approximately 1%. All right. So it's not a large number.
The education is there for individuals?
Well, I would say yes. There's been a big sort of surge in public health education for STIs in general. Okay. Obviously the leader is the HIV guy, right. And then all the other ones are sort of, jumping on the bandwagon. The problem is that unfortunately when you have a syphilitic lesion or a herpetic lesion, you're that much more likely to have HIV. Mm-hmm. So they all are part of the bandwagon. So when we do public health education all the time, so if I'm counseling a patient on that from in my office, it will be part of the regime, and one of the blood tests that you will take will be an HIV test almost automatically. Yeah. So
you mentioned herpetic lesions. Right. You did your project on
genital herpes.
Okay.
And
what did you find?
It's a common STD, and it is sexually transmitted, and also skin to skin as well. And it's painful. The initial outbreak tends to be very painful, and that's when people actually get concerned because it presents as a sore. And it takes about a couple of weeks to heal or for it to go away initially, and then the recurrent outbreaks tend to be in shorter duration and less painful. So
once these things manifest themselves, are we then saying that these are things that people will have to live with for the rest of their lives? We mentioned treatment options, mm-hmm. but is treatment necessarily a cure?
You want to take that one? You want to take that one?
Oh.
Okay.
We can start with you. Yeah. Based on your research from each of the different areas.
Well, basically, this is a little bit different because MC, or molluscum contagiosum, the treatment really is a spontaneous resolution. Okay. There are alternative treatments such as cryotherapy, laser, curettage, but typically it's just spontaneous resolution. So there's really no treatment. The prevention-wise, it's very contagious, so it's very important to keep lesions covered, don't share items with others, and in terms of sexual activity, you would want to hold off until you're evaluated by a physician and diagnosed, and from then you would hold off until they do completely resolve. Once they do resolve, it is not dormant in the body, so the virus is gone.
Exactly. Very good. Thank you. And John?
As far as syphilis goes, the primary thing we should always think about is prevention using safe sex techniques to keep from ever contracting this illness. However, if the patient does present with syphilis-type lesions, it is highly treatable with penicillin G and should not reoccur.
Excellent. Thank you.
Unfortunately, with herpes, genital herpes, there's no cure. There is treatment, antiviral medications that you can take to prevent the transmission of herpes and also to shorten the duration of the outbreaks. So I think here with herpes and with so many other sexually transmitted disease, prevention is key. So using a condom and practicing safe sex, also staying with one partner, being mutually exclusive with one partner is very important.
If there's one word that I think stands out through our discussion this evening, it is prevention. That is ultimately the key, and versus contracting some of the infections that we've discussed, but also the bigger picture in talking about women's health and making those changes in lifestyle, preventing things from occurring from the very beginning. Thank you guys for relating both your experiences as well as the research that you've done. Dr. Mansour, I give you the final word, sir. What are some of the things that you think that the women of Antigua and Barbuda, we're not just talking about these were their research projects, but overall the big picture in women's health?
You could probably sum it up as an ounce of prevention is better than a pound of cure. Not just for these, but in just general life. So a lot of the focus of the health fair was prevention, education.
Right.
I think that's all going to be our battle for the next few years as well. Just to have everybody understand basics. It's important for them to also know where to get information. So not only are we going to be able to provide them here, but to let them know what good internet resources are available. There are some that are still shady, so you have to make sure you understand that the source that you're reading is a reputable one, and someone that has a good story or history. But then prevention, just healthy lifestyle. In this particular case, safer sex is the better sex. These lesions aren't easy to deal with. They usually come with an enormous amount of fear, enormous amount of questioning of the partner, etc. And we didn't touch on that, on how we deal with the interpersonal relationships when these lesions show up. But definitely prevention for sure.
Thank you very much.
Thank you.
Thank you again, guys. Stay with us. We'll be right back. We hope you've enjoyed the last few weeks in our discussions on women's health. We also hope that you can at least take away 1 or 2 points that will help you be well as you live your lives. Take care of yourselves, Antigua and Barbuda. We thank you for allowing us to spend some time with you and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.